This conference will now be recorded.
Hey, everybody. Welcome to Allscripts training. Thanks for joining me. I hope you enjoyed yesterday having a day off from training and that you were able to use the time to get caught up on any of the trainings that you might have missed over the last 2 weeks. So hopefully you were able to do that. If you haven't watched all of the training videos, or if you don't have them all of the recordings, reach out to your practice manager and ask them to send it to you. Make sure that you know where they're storing that for your division so that you can have access. Watch them more than once if you need to. There's a lot of information, and so we want to make sure that everybody's comfortable with it as we are starting to go live in the next month or so with some of the divisions. So make sure that that you're watching the videos and that you feel comfortable with your workflow. I am going to launch our application here. I'm going to double click on our cloud link. We created that link for our desktop by going to this E with the halo, dragging and dropping it to our desktop. I then right-clicked on that same icon and clicked the pin to my taskbar, and then I have it listed down here. So if I wanted to quickly get to it, I could just launch it from my taskbar. My cloud login would launch, click sign in, click on my mountain folder, click on my clinical module, and start connecting to the EHR. If you haven't done that yet, I recommend that you do it. It makes the login process easier. It also cuts down your risk of opening it in the wrong browser. We've talked about this before, but Allscripts doesn't like Chrome. It doesn't like Firefox. It doesn't like Safari. And so to make sure that it's opening in Internet Explorer, sometimes it's easier just to use that shortcut. So here I am on my green screen. I'm going to log in with my Allscripts #1 password. If you're having difficulties logging in, whether it be to your cloud login or the green screen, please reach out to your practice manager for that too. They can facilitate getting those reset, making sure that you have access into the system and that you're able to start learning, building, and playing in the system. So last Friday, we went through our workflow. We went through a lot of we went through all of the workflow actually for a patient in the office. Today, we're going to sign off on our charges. I'm going to show you that history and physical, how to review that, why we need to review it, our billing process. I'm going to talk to you about our print packs. I've referred to those a couple of times in our training, what those print packs look like, how we can make modifications to those if we need to. And then taking a look at the documents that we're generating in those print packs. So I'm going to open up our test patient. I'm going to make sure I click my search training patients box, click search. I'm going to launch my test patient by double clicking. Here we have our encounter selection screen. As of Friday, we had our encounter here, but the text was not red, it was black. And the black text we've seen throughout all of our training here. Today's our first day that it's red. Red identifies that we have an outstanding or a delinquent encounter that's open. And that means that we need to sign off on it because it has surpassed our time period in which we have allowed that to be open, which is 10 days. So we want to make sure that if this is red, that we make sure that we go through and that we close our encounters. Again, we're working in a training patient, so we are intentionally doing this for our training patient. But when we're working in live patients, we want to make sure that we're closing those encounters every day on the day of service, so that we can make sure our billing gets sent over. So we have our red delinquent encounter right here. We went through our open encounters in our right margin here the other day, and we have our open encounters. You'll see that we have one that's listed here. It's in brackets and it is red, and then our icon in the back behind the two charts turned red. That is to identify that we have some delinquent charts that we need to get taken care of. We have one delinquent chart. That's why the one, I have two charts open. One of them is delinquent. That's why we have a 1 in the brackets. So keep an eye on that as you're working through your workflow, especially as we go live with each of the divisions. That's going to be important that we make sure that those encounters are signed off on and that we're getting to the charges to our billing departments in a timely manner so that they can bill for them. So I am going to launch my encounter here. We are coming up onto our face sheet here. We've been through our face sheet. We know what this looks like. We know what we're, how we got here. But I want to talk through how we are going to get to the sign-off screen. So we're getting to the sign-off screen because we went through our patient intake. We started here with our demographics. We clicked on our pencil. We went to our other information. We filled in our pharmacy information here. We clicked OK. Then we launched into our contact for the patient. So our reason for a visit, building that HPI, we chose the body part that we're seeing the patient for, and then we completed that dynamic HPI all the way down to the line here so that we meet those MIPS requirements and have the standard met for OCC. Again, if we want to, if our provider, we wanted to choose any of the options down below the line, it's completely up to you. But we do want to make sure for consistency and for OCC workflow that we absolutely fill in this top portion all the way to the line. So our providers are going to have gone in here, go to the note and dictate our information here. And we're going to have that information stored in our dynamic HPI. We've gone to the vitals. We've added our vitals here on the 13th. By choosing our weight and height, it will calculate our BMI for us. If this is a post-op patient, we're going to make sure that we record our temperature, our pulse ox, and our blood pressure, as well as level 1 criteria for our COPIC. So then we are launching into history. We went through the history. We followed our workflow here in our middle column. This coincides with our patient intake form that the patient has filled out. And we're recording the information that the patient shared with us on that form, line by line, making sure that we fill out our allergies, our medications, our past problem list, our past medical history, our family history, our past surgical history, social history, and then meeting the MIPS requirements by going through our flu and pneumonia vaccines and recording when those have last been received by the patient. And so that's what we have for our history workflow. We then went through our review of systems. We applied our OCC review of systems normal. We clicked apply, came down here, and then again, following that work flow from the patient intake form that they're giving us the answers to our quiz here. And we're going to come in here and make sure that if we have something that the patient is indicating they have positive symptoms for, then we're choosing the green check mark box, and then we're bolding it, turning it red by using our exclamation mark. Getting back to our review of history home screen by clicking home, we can then choose our additional information, choosing our pencil if we want to add additional information. Clicking OK, and then seeing that that falls with, in a parenthesis after our present symptoms here, and then also up here. We're going to hit home. We're going to, again, identify some more information that the patient has identified on their intake form, and we're done with our review of system. We're then going to pass the patient chart on to our provider, and we're going to do that by clicking our green arrow here. When we click that, we would be able to identify that the patient is ready for the provider, or send them to X-ray after we order an X-ray, whatever that workflow is for you and your provider. You're going to complete that piece of it, and then click on this green arrow. Then we can identify that it's ready for our provider. So once the provider gets the chart, we're going to go into our physical exam. We're going to apply our physical exam template. We could do that a couple of ways. We could either choose our drop-down arrow and choose one of the ones that we have used on this patient previously. We could also go to our clipboard with our lightning bolt, click on it, and we can choose to apply one of the templates that we have saved here. We want to make sure that when we apply that template, that we only apply it to the physical exam and the assessment and plan, and that we don't include the history of present illness for that, because we want to make sure that we're not overriding what our clinic staff has done for us in the intake process. So we would make sure that everything was clicked, and then we would click OK. So that's how we got our physical exam here. For those who don't want to use a template, we're going to go here to our pencil next to physical exam, and that you're going to document your physical exam here by either using your dictaphone and your voice recognition system, or you're going to be able to build out those memorized phrases by applying your memorized phrase from our A to A drop-down arrow, and then again you choose your physical exam, and then it populates for you. You click OK. And here it is. So we've done our physical exam, we've recorded that, we've gone to our assessment and plan. We went through this workflow last week for 4 days, so we know what this looks like. We've done all of our current plans. We ordered everything that we did that day from our short list listed here. We ordered our future plans, which are our surgeries over here in our bottom right region here. And so we've done our assessment and plan. So we're going to go to our our history and physical. This is the patient's note. This is what we built. This is what we've been leading up to. All of our clicks have built this note. And so if we go down here, we want to make sure that we examine this, that we look at it, make sure that this is really what we want to record for the patient's note here. You can see that everything that we created in the assessment and plan is listed. Our impression is listed up here, so it's quick reference for our providers for subsequent visits here, that we could see what we did. We have our physical exam that we dropped in. We also have what it would look like for our physical exam if we had it built out in our memorized phrases, how it would look here. And we have our review of systems, history, and present illness listed too. So this is what our chart note looks like. And we're going to, because I take a look at it and I say, yep, that's what I want my chart note to look like. And so I'm going to sign off on it. click my sign off button at the top left here. And we're going to go through this screen in depth now. We went through this screen when we were building our physical exam templates so that we could close them out, make sure that we didn't have more than 5 encounters open. But I want to make sure we know what this screen is, and then make sure we know what we should be doing with it in encounter visits. So here, when you launch it, it does put your cursor in the password section. We have turned that off, so you do not need to enter your password to sign off on a chart. So you can jump down here. We have our encounter types. Our encounter types are listed here. These are all either associated with a billable or non-billable encounter type. And so our addendum at the top here indicates that we have changed something that we've already signed off previously. We've gone in and made an addendum or a change to a note that we previously had signed off on, and that's non-billable. If we had an encounter that we were just ordering a boot or just ordering orthotics, maybe the patient came in for a sling or something like that, that we could make just a DME encounter, and that would be billable. Our historical summary here is not billable, and the historical summary would be something that we do to update a chart. Maybe we take a look, we pull the chart open and we're looking in it and preparing it for a future visit as we go through at the division level, and we do some additional training about what it looks like to prepare charts. This will be what we look to use for that historical summary, non-billable. We have a no charge visit, which is not billable. We have a nurse visit that is billable. We have an office visit billable. You'll see at the very top here, that's what we've defaulted to, and that's what our office visits will default to, is a billable office visit. We have our op note, which will be for our surgery charges that we'll talk about at another time. We have order given encounter type, which is what we'll use if a patient calls in, for instance, for a prescription, or maybe they want a new physical therapy order, or maybe they had an Epic Pass, they purchased an Epic Pass, got injured, and now they would like a note to see if they can get that money refunded. If we're putting something into the system, but it's not on a billable visit, order given, non-billable is a good option for that. And then we have our physical therapy visits or OT visits for an evaluation and treatment. So we are going to choose our office visit billable. Again, that will default to that for our office visits. Our billing level here populated because if you remember when we went through our assessment and plan on Friday, we chose that in our drop-down workflow in the last folder. However, we also went through that you could choose it by clicking the bottom underneath our current plans, or I recommended that we wait till we get into our sign-off screen here for us to choose. And so this is where I recommend that you choose your E&M visit. Again, it puts all of that billing together, which I think is nice. You can choose your 99213, 99214, or your new patient visit, and make sure it goes into the billing level. Here on the left, this workflow, this list should be familiar to you. This is what we did through our assessment and plan. Everything that we added to the assessment and plan then pulled over into the billing. So you can see that we have our x-rays and our compression bandage and our labs, everything that we put through that process is here listed underneath each of our diagnoses. We have these little dollar signs here. Some are green and some are gray. When we go live, we will default them. And so they will automatically turn green if it's something that we regularly do in the office. And then it will be gray if it's something that we're ordering. But I'm going to go through this process so that you can understand what they mean. And then I highly recommend that before you sign off on your chart, you make sure that we are billing for the things that we did in the office. So here we did our x-ray in the office, so we want to make sure that that's green. We did our injection in the office, so that's green. Our medication we want to bill for. We are going to bill for our compression bandage and for our application of our cast and for the supplies. We have the next three are our lab orders. Our lab orders, although we're ordering them, we're not completing that. We're not doing the procedure or running the labs in the office. So because that is just an order, we want that to be gray because we're not completing it on this day of service. Physical therapy, most of us have physical therapy in our offices. And although we have it in our office, we are not doing the physical therapy on this date of service. We are ordering it. So we want to make sure that it is gray because unless we're doing the physical therapy, it should not be billed on that date of service. We have our OT therapy here too. Again, that's gray because we're just ordering it. Our air cast is our DME. We want to make sure we bill for that because if we stock and bill in our office, if we have a third-party vendor who comes and supplies that to us and they do the billing, then we would want to make sure that that was gray. But we're going to assume that we purchased that, we keep it on the shelf, and that we dispensed it to the patient. We have our second injection here that we added. We're going to bill for that. Our MRI we ordered, so again, that should be gray. Here in our muscle test, that's our EMG. We are just ordering that, not completing that service today, and so we want to make sure that that's gray. And then again, we have another injection here that we're going to make sure that we bill for, which is green. So that's the left side. That's the billing side of our sign-off sheet right there. And then on the right side, here are those print packs I've been talking to you about. And I'll show you what that looks like. I'm going to add these for our patient education, our referral letter that's going to go to our referring provider, our physical therapy order, our OT order. This is going to be our MRI order, our surgery order, and our labs listed there. In my example for our billing, I said this is a patient who wants us to write a note to help them get out of their Epic Pass, see if we can get a refund for them. So we're going to add a blank patient letter with this as well. And we're going to click OK. Once I click OK, it's going to sign this chart off, and that it will no longer be able to be edited. And so we won't be able to add any extra charges. We won't be able to add anything extra to our documentation. So it's really important that we verify it before we click the OK button. So here we go with our OK, and it's going to start generating those print packs that I was talking to you about. Here on our pop-up screen here, we want to pay attention to this yellow line. It will tell you what it's asking the question for, and so it's looking for the caregiver for our letter. Who's supposed to sign this letter? And so I'm going to make sure that that is me. The next question is asking for our orders. What physical therapy orders? We don't want to include everything that we had in our assessment and plan. It will put everything. It makes it look really ugly. So we want to make sure that we're only adding the items that are applicable. We're going to click uncheck all. We're going to scroll down to our physical therapy and click that box and click OK. Next, it's going to ask me for my OT orders. I'm going to click uncheck all, and then scroll down to my OT orders, click that box and click OK. Here we have our diagnostic orders. What orders are we sending for our imaging? We're going to uncheck all. And then we have a couple of places that we added our MRI here. Maybe that's the only one that we had. I thought we had two for our diagnosis, but maybe that was injections. So I added our outside imaging there. Click OK. It's asking for our surgery order. uncheck. And then we're going to make sure that our surgeries that we ordered, that was our scope, we have our removal of the clavicle bone, we have our reconstruction and our impingement. Make sure all the boxes are checked as applicable for our surgery order, and click OK. Here's our lab order. Intuitively, it's going to connect our lab orders with our lab order form, but we want to make sure that everything is listed here. We don't have anything that snuck in on us. Click OK. And then it's going to generate our print pack. So all of those things that we went through box by box are listed here to the left in the left column. We have our patient education, we have our referring letter, we have our physical therapy, occupational therapy, our diagnostic imaging, our surgery order, our lab, and then our blank order form. I'm going to show you what each of these look like quickly. You can see what they default to here. You have three buttons here. You have properties, preview, and then you have edit. Edit is the screen that you can come into and add anything additional. We chose some patient education for the patient regarding the rotator cuff injury. This is what it will look like. If we're on our edit screen, we can add some information that we want our patient to know. We could also indicate that we don't need to put how long the effects last, and we could take that piece out and edit it the way that we want that to look for the patient before we send it to them. Our referral letter will populate, Here's what it looks like. Our to would populate by the information that we have built in for the patient's referring provider. Here, you can see that it says, thank you for sending the patient to us. Here's a brief summary. And then it's going to give us our dynamic HPI that we created, our assessment and plan for the diagnoses that we added for the patient. Our physical therapy order is listed here. If you recall, when we were doing our assessment and plan, we talked about those character limits that we have. We have some character limits. We have 240 character limits when we're going through our assessment and plan, and that might not be enough for us. And so this is the place that I was telling you that we could add some memorized phrases and build out our memorized phrases in a way that might be really helpful for us. And so we could come in here, we could click the box, and we could use our A to A, our memorized phrases, and then we can drop in our orders that we want to be there. There is no character limit here, so you can be as specific as you would like here in our therapy order. And when we close this, when we say OK, our additions, our edits will be saved into the patient's chart. So we have the same thing for our OT order. Again, you can go to the edit and see what this looks like. You could also drop in any of our memorized phrases that you wanted to include. We have our diagnostic imaging. Again, if we wanted to preview it, we go to our middle tab. If there was additional information that we wanted to add in our edit, maybe we wanted to make sure that we knew that this was stat order, please read and call, maybe, that we wanted to make sure that we add that to the patient's order. We could then underline it so that it stands out. And if there's something, again, that we want to make sure that we add to this, if we didn't add our rule out diagnoses, this is where we could add that in our edit. Our surgery order form here, again, if you didn't add it to the information when we ordered the the surgery. This is where we would add that information again through our memorized phrases. We could build those out, or we could type it. You could also come in here with your dictaphone and dictate directly into the edit screen. We also have our lab orders here that we would send off. And then we have our blank letter that we generated. Again, we're going to go to our edit tab. It's going to default blank, but we could put in here, again, using our dictaphone, typing, or maybe we have a memorized phrase that we want to drop in here. And then we would click OK. We've been through all of our output items, and if we click OK, it's going to generate that. These boxes won't come up. I just have them printed to file, so that's why that came up. So here we are back on our desktop that we're used to seeing when we log in. You'll see over here in our right margin that encounter that I had that was red, that was populating this red, turned our icon red, had that one in a bracket, is gone because we've now taken care of our encounter that was overdue and delinquent. So you'll see now I only have one encounter, and that is open within the range, that 10-day range. So that's why that red went away. If I go back and look up my patient that we just signed off on, all of those items, all those documents that we just looked at, we just edited, that were printed in our what are called print packs in our sign-off screen, are populated here in our attached documents and on our face sheet. As a reminder, this top third of our right column on our face sheet is what is filed in our patient's chart. So if I maximize that so I can see the whole thing, and if we go into our attached documents, this is our order for our diagnostic images. This is what we just signed off on. Here's our PT order and our OT order that we just did. Same thing for our surgery order that's listed here. That's going to go into a queue like we talked about before for our surgery schedulers to work on as well. Our office correspondence is that letter, that Epic Pass letter that we wrote. We have our orders for our lab. Our patient correspondence is that thank you letter that we sent to our referring provider. And then we have our patient education that we have there. If we wanted to look at any of those, we could double click on them. It launches to our view screen, and we could take a look here. We could send from here as well. However, we're going to talk through that workflow in a future training for our faxing. Our diagnostic images and our PT orders, our diagnostic imaging orders and our PT orders are going to auto fax for us, as will our referring provider letter. So that will happen automatically for us, which is great, and less clicks. Makes up for some of the additional clicks we have through our assessment and plan pieces of it as well. We have some questions. I know we've gone over about 5 minutes, and I apologize for that. For those of you who can stay and listen to the questions, I'm happy to go through those, and I'm going to start answering those. And if we have additional questions, I can stay on the chat for a little bit and answer additional questions as we go. So the first question is, can an MA order x-rays without having a diagnosis in the assessment and plan? Yes, they absolutely can. You would order it, and then as a reminder, we went through this in our assessment and plan. When we add the diagnosis, we're going to drag it and drop it to the top and pull it to the top, and then all of our assessment and plan items will fall under that diagnosis. So our MAs, our clinic staff can absolutely order an x-ray without having the diagnosis identified at the beginning of the visit. Second question, will this billing section replace the paper super bill? In which case it will need to be completed before the patient checks out. So it will replace your paper super bill. When you sign off on that screen, it will push all of the billing information to your billing team so that they can accept those charges and then get them out to the insurance company. How you do that, whether you do that before the patient leaves or by the end of the day or that evening, will be up to you and the division workflow of how you make sure that those charges get to the billing team in a timely manner. Next question is, what if you have multiple people involved in the patient's encounter, such as a tech that fits a patient for DME, an MA, and a provider? Will the tech be the one to order the DME? Is there a way to put the encounter billing on hold so that all persons involved can do their billing with on their own time before signing off? Rachel, that's a good question. That's going to be a division workflow answer. So unfortunately, I can't answer that. Every division might choose to do something different. So I would hate to give you a direct answer on that. In short, when the encounter is signed off on, again, you cannot add any more charges or documentation to it. So we would need to make some decisions in each division of how that workflow is going to look like. And we'll talk about that when we come to your division and do some division training. Next question, can you print off a PT script for the patient without having their chart completely done to sign off on? Yes, you can. We're going to do that. We're going to go through that workflow in our documentation and forms training coming up. But yes, you can. Next question, what is the best thing to do in the plan if it is the same plan for multiple diagnoses, medial and lateral epicondylitis? Where should the plan go? Duplicate it under both diagnoses or just under one? So you would need to, if it's medial and lateral epicondylitis, you can make the choice of how you want it to look in your chart. You can add two diagnoses to the same workflow. We're going to talk about that in our enhancements training piece of that, so we can certainly go over that. Good question. We haven't covered it yet, but we absolutely will. If X-ray was done for multiple diagnoses, where does it go? Same workflow. We're going to show you in our enhancement process of what that looks like. A question, does all the patient education go into their portal? The answer is you can push it to their portal in that screen when we were going through each of the items, and we could edit them. We could edit them and then push it to the patient's portal. You would have the option of emailing it to them or also printing it for them for that piece of it. So those are the questions we have in our chat. We are about 2 more minutes. If anybody has any additional questions, I'll stick around on the chat. I know we got a lot of information today, so I apologize for going fast, but I wanted to make sure that we could get through that sign-off screen. Join me tomorrow. We're going to go over our next piece of training. We're going to review this in quick review. So if you aren't sure about some things, have some more questions, think of something in the middle of the night tonight that you want to ask, come back tomorrow so that we can go through that workflow and make sure that we get everybody's questions answered. But thank you for your time, and I will stick around on the chat for a few more minutes to answer any additional questions. Thanks, everybody.